Today I'm presenting AB 1223, which seeks to take the first step in addressing ambulance patient offload time, or wall time, at hospital emergency departments by defining the term and creating a standard for measuring and reporting. Wall time can be defined as the amount of time it takes from when an ambulance patient arrives in the emergency department to when they are in a hospital bed in the emergency room.
We're noting that more and more people are using the emergency department as a gateway to their health care, resulting in overcrowding and delaying of offloading patients, as has been shared already. This delay decreases the number of ambulance units that are available to respond to subsequent emergencies, and also creates a burden on fire engines and trucks that remain on scene awaiting the ambulance arrival due to those response time delays. That also keeps those engines and trucks out of service for fire-related emergencies as well. The backing up of resources is not a result of ambulance traffic. It is due to the hospitals being unable to process patients fast enough on their side of the system. This offload waiting time, dubbed as wall time, or ambulance patient offload delay, is a regional problem, and it affects each system slightly differently. What may be acceptable wall time in one region is not in another. Some regions have reported wall times that exceed several hours, and some as short as 30 or 40 minutes, and in each case, those can be very extreme and significant.
This loss of production in both the private and public sector comes at a great cost. The private sector ambulances will have to increase their costs by increasing their staffing, and the public sector costs are burdened by the local taxpayers. Several fire agencies across the state, including those in Los Angeles, Sacramento, and San Francisco, have studied this lack of production, loss of production in the tune of millions of dollars per year. Many ambulance providers across the state are penalized by fees for delayed and response times, which also can cost hundreds of thousands of dollars. This bill requires standard methodology for calculating wall times, but allows the local EMS system to establish what constitutes acceptable wall times in their area. For this reason, the California Fire Chiefs Association supports 1223, urges an aye vote. Thank you for your time in allowing us to speak on this matter.
This bill comes out of my own experience as a Long Beach City Council member, where we dealt with this issue in our own city. And what was happening was our paramedics would respond to a scene, take a patient to a hospital, and sometimes would be tied up for as much as 5 hours, leaning against a wall with a patient, waiting to get an emergency bed available. So what we're seeking to do with this bill is work with the stakeholders and find a solution.